welcome. Thank you so much for being here. Um, so I am Hunain, the co-founder of Cyglera, and this is our first ever webinar. I'll be the host today. So welcome to Beyond Benefits, Improving Workforce, Metabolic Health Through Lifestyle Medicine and Continuous Care. Just a couple of things. We'll be here for about 50 minutes today. We'll have 10 minutes Q&A session at the end. And along the way, if you have any questions, you can just drop them in the chat and we'll take a look at that. We have two presenters today. The first one is Dr. Robert Graham. Robert is a Harvard-trained physician and a trained chef, which actually tells you a lot about how he approaches health. He's also board certified in both internal and integrative medicine. And he's also one of the leading voice in lifestyle medicine. He had a couple of TED Talks also on that. He co-founded Fresh Medicine, where he was the medical director of integrative medicine. And he is going to open us up by framing the problem, why the traditional approach to employee benefits fails short, and what continuous coordinated care looks like instead. Then the second one that we have today is Dr. David Ritter. David is the professor of kinesiology at Brock University in Canada, where he leads the Power Code program at the BIF Center. And he makes exercise generally accessible for people living with chronic conditions. His research digs into chronic inflammation, cardiovascular health, and exercise. And he is going to take us under the hood, what the data actually says about making weight loss and behavior change last, which matters a lot more than ever in the GLP-1 era. So with that, I will pass it off to Dr. Graham to talk about the workforce.
Fantastic. Thanks for the generous introduction. And I look forward to having this discussion with all of you today and hopefully moving the needle when it comes to workplace wellness. We all work and we want our employers to support our health journey. And today's talk will really focus on the fact that, yes, benefits are important when it comes to workplace wellness, but really enrollment and, more importantly, engagement is the key to success. So with that, I will begin my talk. And so as we all know, regardless if you're an employee or an employer, we're at a crisis point. 73% of our workforce in the US are overweight. Almost $2 trillion are lost in productivity, annual income burden of chronic disease on US employees. And this cost is continuing to skyrocket. The other major issue that is happening at this time is this. We have this magic pill called a GLP-1. And they are hugely successful in terms of weight loss and reversal of many chronic diseases. But we're seeing a huge disparity on what is covered, what isn't covered. And in some cases, employers are quickly just dropping the coverage for GLP-1. So what happens while you're on one or you want to be on one? And then last but not least, I want to mention the fact that when we are not well, when we are victims of metabolic conditions, like things like diabetes, hypertension, high cholesterol, and obesity, we also means that we have twice the many missed work days. And so as you can see, there's a convergence happening and it is accelerating. And so we hope to offer a meaningful, sustainable solution for your health needs in the workplace. And so I have to applaud. I've been in this space for roughly 20 years. And what I have seen in the last 20 years is it's been an increase in employee benefits. But traditional benefits fall short. And plain and simple, it's really not the fact that we offer it to our employees. But in fact, the bigger issue is that we don't engage with them. And this is where sustainable behavior change is the key, what we'd like to offer all of you today. And so most wellness programs see participations below 30%. Oftentimes we see the fact that the people that need it the most use it the least. And really what we feel is a major gap in this industry is what happens after those sessions. So it's great that we're having more nutrition sessions, lifestyle sessions, fitness sessions, workplace wellness, but what happens in between the visits? And that's what we call continuous care. And that's where we feel that the accountability is really the cornerstone of longitudinal support. And oftentimes we see siloed benefits. We see things like nutrition benefits, primary care, insurance coverage, pharmacy benefits, but in fact, they're siloed. They're not continuously working together. And last but not least, I want to mention the fact that we are offering more and more benefits to our employees. But really what employers want to understand is the ROI. How well is it moving the needle in terms of healthcare costs and healthcare improvements? And that's where we fill in the gap as well. And so let me introduce to you a new concept that we feel is the magic bullet in the workplace wellness space. And this is where we bridge the gap between clinical recommendations and real world implementation, combining clinical rigor with sustained human support. And so, yes, we use technology, but more importantly than anything, you have leading experts in the field of nutrition, exercise physiology, which you'll hear from David today, really trying to move the needle when it comes to sustainable engagement within our workforce. And we're focused on four things: lifestyle medicine, food as medicine, care navigation, which is so important, and last but not least, digital engagement. And we frame our approach using the 6 pillars of lifestyle medicine. This is grounded by the American College of Lifestyle Medicine framework, the only evidence-based model clinically shown to reverse chronic diseases. Focuses on whole food nutrition, physical activity, restorative sleep, stress management, social connections, and avoiding risky substances. And so within our platform, we address these 6 pillars of lifestyle medicine, again, with real life support using technology between visits, between episodes of engagement. One of the things that I have found really powerful in the space of employee wellness is the number one thing that most employers want to engage with their employees on is nutrition. And in fact, nutrition is the most underused lever in employee health. And this is where we come in. We translate clinical guidance into practical, sustainable daily actions inside and outside of the workplace. So yes, we do have programs that focus on workplace wellness within the workplace. But what happens when you go home? What happens when you go to the gym? What happens when you go to commune? And this is where we come in. We come in between those visits. Some of the programs that we focus on are medically tailored nutrition. These are personalized plans aligned with each metabolic risk profile of your employees. Culinary education, a fascinating field, hands-on culinary skills that make healthy eating practical and enjoyable. Last but not least, we also work with the workplace. If you do have cafeteria, we offer guidance, meal planning tools, and on-site clinical support. And so one example I really want to focus on, and I know David will be speaking on this as well, is that the medications alone is not a metabolic strategy. Yes, as I said before, as a doctor with 25 years of experience, the explosion and the utility of GLP-1s has been fascinating to watch, and they work. But what happens as you are trying to get on one, while you're on one, and when you're trying to get off one? The research has shown that roughly patients on GLP-1s usually max out their weight loss at about 16 to 18 months. So the gap is really when GLP-1 prescriptions without lifestyle medicine support lead to rebound weight gain and continued risk. The bridge, we wrap behavioral coaching, nutrition, care navigation around that medication therapy. And again, we measure everything we do. Sustainable metabolic health that reduces long-term dependency on GLP-1s is the goal of, I think, healthcare, but also our programs. And just focusing a little bit about the ROIs, what have we seen so far? We are built for accountability. We want to be put to the test. Every program generates longitudinal data that connects behavior change to hard financial and clinical outcomes. And we've seen 30% reduction in chronic disease-related claims over the course of 3 years. Again, for us, longitudinal data is key. Claims reductions is what we all want, fewer high-cost chronic disease episodes, and addressing this productivity gap that I spoke about earlier. And so let me share with you a real case based upon real outcomes. So we were able to engage with an employee, and it's really a transformative story. A mid-sized employer enrolled about 150 high-risk employees in our continuous care program, again, over the course of 12 months. It's not necessarily what happens in the workplace, it's what happens outside of the workplace that really focus our efforts on. Again, the average weight loss was about 18 pounds. We almost saw a 1% reduction in A1C. We had 42% sick fewer sick days. And again, throughout the course of 1 year, we saw high engagement. This is where the key enrollment is. They say the easy part, engagement is the challenge. And we've seen about over 90% engagement. And employees reported higher energy, focus, and job satisfaction, while employers saw measurable drops in their claims and GLP-1 utilization. So it's a win-win for all. Again, we just want to reiterate the fact that benefits are great, but alone don't change behavior. And this is where what we try to offer continuous support does. Combines the latest of evidence-based lifestyle medicine, food as medicine, and again, engagement, what happens in the office and out of the office, by trusted care coordination under one integrated platform. Again, just want to focus on three major pillars that we want to share with you all today. Continuous care. What happens outside of the workforce? Everything we do is grounded on evidence using the ACLM 6 pillars, and we adhere to peer-reviewed research. We also measure everything. Measurable ROI is so important, and what we have found in the workplace wellness space, that oftentimes offering something is great, but really measuring the impact is what makes it sustainable. Next, I will share the slides with my friend and colleague David, who will talk about the science behind sustained behavior change. David, take it from here.
Thank you. Yes, I just have to share my slides here. Okay, how's that, Hunain?
Looks good.
Okay, thanks very much, Robert. I'll take over from here. And again, thanks for the introduction. As Hunain mentioned, Dr. Deiter, I'm a professor of kinesiology at Brock University, and I'm also the director of a wheelchair accessible exercise facility called PowerCord. And my research really focuses on the secondary health complications that accompany neurological disability. And so I'm interested in the role of exercise, but more and more also the role of nutrition in helping to manage some of these secondary health complications. So,
David, can you reshare your slides? Your screen is full on that. Okay, we see it now.
Now you can see it?
No, it's gone.
Okay, so I'm going to run through a couple of studies that were conducted in my lab over the last several years.
Sorry, we don't see the slides. I think they're gone again.
Oh. How's that?
Yeah, looks good now.
Okay. So like I said, I'm going to run through a couple of studies that were conducted in my lab and really use those studies to share with you lessons that I've learned regarding what are the ingredients for long-term adherence to healthy lifestyle and especially healthy eating. So like I mentioned, a focus in my research is the secondary health complications that accompany neurological disability. And a large problem is chronic inflammation. And people with neurological disability are susceptible to chronic inflammation for several reasons. And what we find with that inflammation is that it does lead to many different secondary health complications. So what I've been interested in my lab is, can we reduce chronic inflammation? And I've done this with exercise and, like I said, more recently with diet. Can we lower this inflammation via diet? And if we can lower it, do we see the reversal of some of these health complications? So a few years back, we did a 3-month randomized control trial in my lab where we looked at a 3-month anti-inflammatory diet. We had 20 people in this randomized control trial. Half of these people adopted a 3-month anti-inflammatory diet, while the other participants just ate as they normally would. I can get into the details of this diet maybe in the Q&A period, but just basically what this diet did was it eliminated a lot of food items that are known to be pro-inflammatory. So we limited foods with high glycemic indexes. We restricted cow's milk, hydrogenated oils and processed foods were eliminated, and we also eliminated alcohol and coffee. The diet that we put them on was, of course, a whole food diet, mostly plant-based, and we also had them supplement with some anti-inflammatory supplements like omega-3 fatty acids, chlorella, which is an algae, antioxidant capsule, turmeric or curcumin, and a veggie-based protein powder, which they had daily. So in this study, like I said, it was 3 months long. We took a few different measures before and after this intervention. One thing we looked at was just adherence to the diet. We wanted to make sure they were eating as we told them to eat. We really did want to see, is this diet actually anti-inflammatory? So we took blood samples before and after the 3-month period in both groups to see, are we actually lowering inflammation in the diet group? And then we had reason to believe that this lowering inflammation may help to reverse depression because chronic inflammation can interfere with serotonin production and usage. And we also thought that lowering inflammation may reduce what's called neuropathic pain, which is a major problem after spinal cord injury because inflammation can sensitize these pain pathways. So that's what we did in this 3-month diet study. Just kind of quickly share the results with you before I get into the lessons we learned. The 3-month anti-inflammatory diet was highly effective. Like I said, we took blood samples and we did actually reduce pro-inflammatory mediators in circulation by about 28%. And we had very large, really nice, encouraging reductions in both neuropathic pain, as we measured by the neuropathic pain questionnaire, and we measured depression by about 55%, as measured by questionnaire as well. These are nice, big results that actually rival what you get with traditional medications in the spinal cord injured population. So we were highly encouraged. We did lower inflammation in our diet group, and we did have nice benefits for reducing neuropathic pain and depression. So there was the results of that study. We were very happy about these results. Several publications came out of it. I'm just showing you 2 of the higher impact publications that we published in the Journal of Neuroinflammation, where we showed that we did, in fact, lower depression and neuropathic pain with this 3-month anti-inflammatory diet. Okay, that was a great story. We were very happy about all those results. I should mention, we also measured, like I said, we measured adherence to the diet during those 3 months. Our diet group was very adherent. They stuck to the diet with a rate of about 89%, which is quite high in an intervention study. You can see the range there. Our participants stuck to this diet with a range of 70% to 100% compliance over the 3 months. We had, like I said, they had that one person that had 100% compliance and never cheated. Just a funny side note, she gave us a call on Christmas Day to ask permission if she could have a pickle at a Christmas party, and we said, yes, by all means, enjoy your pickle. But there was very high adherence to this diet when they were in the 3-month study. The interesting part that I want to share with you is that we did a 1-year follow-up of all these participants. And despite all the benefits they had in depression and despite the benefits they had in neuropathic pain, 1 year later, we remeasured their adherence and it was back down to 43%, which we found surprising. This diet was so beneficial for a lot of their symptoms, but 1 year later, they simply reverted back to baseline eating habits. And so there's a really important lesson to be learned here. There's a couple lessons to be learned here. One, yes, you can lower inflammation with an anti-inflammatory diet. And yes, you can realize various health benefits from lowering chronic inflammation. The other very important lesson, of course, though, is that for long-term adherence, you need something else. You need something more effective. Okay. So like I said, lesson number one, nutrition can dramatically reduce chronic inflammation, and it can alleviate a lot of health complications people really struggle with. But on its own, it's not sufficient. You do need long-term engagement with people. You do need to try to offer some kind of behavioral coaching in order for a really long-lasting lifestyle change. So that's the really kind of very important lesson number one that came out of my lab. Or actually, I should say it's a two-part lesson. Nutrition can be highly effective, but you have to be a little bit more engaging and hand-holding if you want to realize a lifestyle change. The second study I want to talk about was kind of a follow-up to our initial diet study. The reason why we did a second study, which we call the Mad Dog study here, is that in our initial study, we didn't really think to measure weight loss. This was not a weight loss diet per se, so we didn't actually measure body composition. But we had a lot of people report to us they were losing a lot more weight than we expected, and they were quite happy about that. They were losing weight on that diet. So we wanted to do, again, a subsequent study. We put them on an anti-inflammatory diet. The diet was slightly tweaked to make it a little bit more easy to comply to. It was a 6-week study this time. And in addition to, again, taking blood samples, are we affecting inflammation? We also used a DEXA scan to measure body composition. If we were losing weight with these people, we want to see exactly what body composition changes were we making. So the results that I'll share with this study is that we did get, again, with our 6-week anti-inflammatory diet, we did lower chronic inflammation, again, as measured by blood samples. We reduced CRP by about 34%. We did lose body weight. As you can see, we had about an average of about 3 kilograms loss of body weight, so just scale weight that they lost. But our DEXA scans allowed us to look a bit more closely at that. We did have about a 1.8 kilogram reduction in fat mass, which was nice to see. But unfortunately, our DEXA scans also showed that the weight loss they experienced also included a loss in muscle mass. And that's obviously not what you want to see. You want to see weight loss that's strictly fat mass. You certainly don't want to lose lean mass when you're trying to eat healthy and do good for your body. Okay. We shouldn't have been surprised by that finding of the reduction in muscle mass, reduction in lean body mass. If you look at the literature, you'll see that's exactly what you can expect when you go on a calorie-reduced diet. Not all of these diets are meant to be calorie reduced, but when people start eating healthier, just naturally their calories seem to go down. Anyways, aside from that, when you lose weight from diet alone, very typically 20 to 30% of that weight loss is going to be muscle mass. So said another way, for every 10 pounds of weight that people lose via a diet, about 7 or 8 pounds is fat mass they're losing, but unfortunately 2 or 3 pounds of that is muscle mass that they're losing. You don't just see that with things like our anti-inflammatory diet. That's exactly what you see with GLP-1 medications. People are drastically reducing their appetite. They're drastically reducing their calories. They're losing fat and they're happy about it. But a lot of people don't realize how much muscle mass they are also losing with these diets and with these medications. This often brings about a vicious cycle that we see with GLP-1 weight loss. So people take these medications, appetite is reduced, we get calorie restriction, they lose scale weight, they're happy with it, but with that loss in fat mass, like we see, 20 to 30% of that is loss of muscle mass. What's the problem with that? Well, when we lose all that muscle, we reduce our basal metabolic rate. We're simply not burning as many calories at rest because we've lost that furnace in our body that burns calories all day while we're resting. So we lose a metabolic rate. And then eventually, like I said, what happens is if there's no behavioral coaching, if there's no contact with these people, if they're left to their own devices, eventually they're going to get off the medication. They've lost the weight they wanted to lose, and their eating habits are going to go back to what they were at baseline. What happens with that is their weight will rebound. But what happens when their weight rebounds? They regain the fat they lost, but the muscle mass stays low. And then they do it all over again. They go back on the drug, back on a diet, they reduce their calories, and we start the whole cycle over again. And this is not a long-term healthy solution for people. What we're hoping to get when we lose weight with a diet or with a GLP-1 or anything else is what we call high-quality weight loss. What that means is losing weight, but strictly only losing fat mass while retaining muscle mass. So the question is, can we achieve high quality weight loss? Is it possible to have people lose weight and have that weight loss be strictly fat while retaining their muscle mass? And there's plenty of research showing that high quality weight loss is achievable, but it does require a few considerations. One way to achieve high quality weight loss is to pair your calorie reduction with exercise and specifically with resistance training. When people go on low calorie diets or GLP-1 medications, they can mitigate the losses in muscle mass if they also pair that diet with resistance training. And the research has shown you can attenuate the losses in muscle mass by about 93%. The other strategy, if you want to achieve high quality weight loss, is that while you're on this low calorie diet, while you're on the GLP-1, if you make sure that you're getting enough protein in that diet, you can mitigate losses in muscle mass by about 75%. How much protein? At least 2 grams of protein per kilogram your body weight per day. What if you do both of these strategies? What if you make sure that your diet includes high protein and you engage in resistance training while you're on these diets or on these GLP-1s? Then not only can you mitigate losses in muscle mass, you can gain muscle mass while you're on these diets. Okay, I'll just kind of quickly explain this graph to people. What you're looking at here is a study involving 2 different groups. Everyone in this study was on a low calorie diet, and everyone in this study was engaging in resistance training. There were 2 different groups. One, as you can see with the black bars, were consuming a high protein diet. The open bars were just eating normal amounts of typical protein intake. Okay. BM here shows what happened to the body mass. Both groups lost body mass. Both groups lost weight. If you look over here at FM or fat mass, both groups lost fat mass as expected. The high protein group lost a bit more, but both groups lost fat mass. Let's take a look at this interesting piece in the middle. LBM, this is lean body mass. Remember, everyone was on a calorie-restricted diet and everyone was resistance training. In the low protein group, they actually maintained their lean body mass. Why? Because they were also resistance training. Look at this closed bar now. These people actually gained a significant amount of lean body mass because not only were they resistance training, they were also eating a high protein diet while on this low calorie diet. So yes, high quality weight loss is achievable, but it takes a little bit of know-how and some other considerations. This leads to very important lesson number 2. Like I just said, yes, we can achieve high quality weight loss. We can maintain our muscle when we're on low calorie diets or GLP-1 diets, but we need a few ingredients. We have to be using evidence-based dietary guidance, okay, ensuring enough protein for the person's own body mass. And we have to use exercise physiology. We have to offer supervised resistance training evidence-based resistance training to help people achieve this goal. And that's a very important lesson number 2. So again, bringing this back to the Cyglera platform that we think is extremely beneficial, it is basically your one-stop shopping for all of these ingredients that are needed for long-term healthy lifestyle change. We are offering evidence-based nutrition. We know these anti-inflammatory diets can be highly beneficial. There's a lot of fad diets out there. These are evidence-based nutritional diets that we're using that have been, shown beneficial through our own research. We pair those specialized diets with exercise prescription to make sure that people are engaging in whatever exercise they need to engage in to ensure high quality weight loss and not get into these vicious cycles with losing muscle mass. And very importantly, we also offer these behavior change coaching sessions as well, because we know information is not enough. We actually have to help people make these long-term behavioral changes in order to make not just a 3-month benefit in their life, but an actual lifestyle change that's going to last for many, many years. So really, we are one-stop shopping for all the ingredients that people need for their long-term lifestyle, exercise and diet benefits. So to summarize here, I think I'll hand this slide back over to Hunain, and he can kind of just summarize, 4 main ideas that we went over in our webinar here, and then I think we'd be delighted to take any questions people have.
Yeah, David, Rob, thank you both. And I just want to pause here for a second because the through line is wood saying out a lot. Rob started us in the boardroom, the real cost of metabolic disease and why benefits alone, they don't change behavior. Then David took us all the way down to cellular level, why high quality weight loss, fat loss, muscle kept only happens when nutrition, exercise, and behavioral support all are coordinated and not scattered. So 2 experts, but completely different starting points. And the same conclusion, what works is continuous, coordinated human care between the visits. And that's exactly the whole idea behind Cyglera and why it was formed. Thank you both for speaking on your respective topics, and now we will open up the floor for questions.
Thank you.
If you have any questions, you can either drop them in the chat or you can come off mute and speak up.
People tend to be shy.
Yeah.
Well, Hunain, if there's no further questions, I think you should maybe tease the audience with what's coming up next.
Yeah. So basically, you can look at our website, Cyglera.com, and what we're trying to do is we have already our mobile apps out on Google and Play Store. So what that does is when patients sign up, we are automatically assigned to a care team, which includes a dietitian, fitness coach, and a behavior coach. And then on the provider side, every provider can see what other providers prescribing to the patient. So a dietitian knows what fitness routine the patient is going through. A behavior coach knows what diet the patient is on. And all 3 of these providers, they now work in tandem towards improving the lifestyle of a patient. And in the mix, we will also in future integrate physicians with it. So if physicians are providing medication to the patient, then they also know what diet, what exercise, and what behavior routine the patient is on, and everything that works basically in tandem. So go out and download our mobile app on the Google and Play Store, Cyglera, Cyglera Health, and then sign up as a patient, see what we have available. And if you are a provider, you can go on to Cyglera.com and sign up as a provider if you want to come on board with us.
Move ring closed.
Thank you. With that said, we will end the webinar. If you have any further questions, you can reach us out via email, info@cyglera.com. And thanks again, everyone. Take care, and let's go build a healthier workforce.
Thank you very much.
Thank you.
Thank you.